Hello, everyone, and thank you for being here today. What I hope is a lovely summer day for everyone. It is a privilege for me to be here contributing to this series of hub seminars, which, as Chris said, has um, approached this interesting topic of healthy urban places from different perspectives. And we're bringing another perspective, slightly different approach, maybe from the urban morphology perspective. And this research that I'm presenting today is being developed by a team, a wonderful team of researchers, including Dr. Yi Shang Sun, Dr. Kim Kranz, Dr. Hedy Salat, and Professor Laura Vaughan, who are all here today in the call. And I hope they are going to be available for questions at the end and to have the conversation that we want to have when I finish the presentation. So, a brief outline of the presentation. So why healthy high streets, what we did, what we found, and sort of implications or recommendations for policy and practice. So why healthy high streets? We know it's been said in this here in this seminar that the places where we live shape our health and well-being. We also know that high streets are tend to be key elements in the areas where we live. So high streets are important. High streets, namely the most central street in the neighborhood, is and have historically been about more than just retail, because they also include healthcare, community services, and social civic institutions. This makes them very important in our areas. And by offering this mix of amenities, high street give people reasons to be out and about to complete necessary tasks. They also provide spaces to be around others and spend meaningful time with friends and acquaintances, or maybe just sitting there on a bench or in the wall, like this gentleman there, just watching people that pass by. And all this, the evidence tells us that it's good for our physical health because we're doing physical activity to go out and about, and we our mental health because we are connected with others. So high streets are really important, but high streets can help people stay healthy, but only if certain conditions are met. And this is where high streets and the streets around high streets, the streets we use to get to high streets. So to have healthy high streets, several aspects are needed. And this has to do with having safe and wide pavements and convenient crossings and low traffic volumes and speeds, and trees and greenery, and healthy retail environments, and even public toilets. So the health in the high street research, it's growing, especially the cross-sectional evidence is growing. And this evidence has a primary focus on the retail environment. So looking whether the food environment is offering healthy food or not, or whether there are gambling outlets or not. And even some colleagues in our research team are looking at these things. But what we want to do is to bring a couple of contributions to this um, research environment. And these are bringing the concept of salutogenic, which I will discuss more in detail in my following slides, but it's just to say that it's wider than health outcomes. And the other aspect of our contribution has to do with understanding change over time, which is less studied and less understood. But we think that is really important, especially when we talk about high street, because these high streets are entities that have been there for centuries. So how they change and what does this mean for health is really important to study and to understand. So what we did, because we wanted to have this wider understanding of health, we started by developing a sort of framework of what a health promoting and salutogenic high street is. And a key thing of this salutogenic thing we're bringing is that health is not seen as an outcome, as a final thing. Health is seen as a ongoing process, relational process, and this process is an interaction between the person and the environment, and it's ongoing. And what we're saying is that a high street that promotes health is a high street that promotes routine movement and walking, that enables access to services and facilities, and that it facilitates social encounters and interaction. And this is what the literature is saying. And then to bring the salutogenic, which is more about well-being aspect of it, um, a salutogenic high street is one that is manageable. So this has to do more with subjective well-being, so how people feel or their emotions when they are in the high street. So whether a high street feels manageable, whether it feels comprehensible, so it's easy to navigate, and whether it's meaningful, so it has a sense of place and identity. So we put all these things together and we looked at the literature and we created a sort of pathway between the built environment, these sort of healthy behaviors, and then the health improvements or the well-being improvements. And the built environment aspects that we identified that are linked with this. And although I'm presenting here like it's very sort of linear one-to-one, it's really not like that. And this is what this circle in the back is meant to represent. This is all interconnected. So we say that street pattern, in the sense that having more walkable or connected networks and places, should support routine movement and walking. And that land use patterns in terms of mixed land uses should support access to services and facilities. But we also know that this is connected to having good street network and good connectivity. And then we know that built form patterns, so having smaller building footprint areas and active frontages facilitate social encounters and interaction. But again, this is all in connection with the other two things, because we need to have people in the high streets in the first place doing things and walking there so that we can have that social co-presence. And these are kind of linked as well with the salutogenic features that we are mentioning here. So in a nutshell, what we did is that we examined these spatial patterns of these built environment features of the high street that support health and well-being. And we did this over time. So how do places evolve over time, and what does this mean for health? To answer this question, we look at three epochs: the 1900s, the 1960s, and the 2020s. And we did this in our two cities, because this is developed in the context of the HOP project, so in Bradford and Liverpool. And within those two cities, in our community sites. So if you know more about HOP project, HOP is embedded in the communities, working very closely with community organizations. And when we wanted to identify the sites and the high streets for our case studies, we did a process, a long selecting process, to go first from which sites are representative for understanding what's happening within the city and between the two cities comparisons. But then once we identified these high streets with the help of our colleagues and other stakeholders, once we identified these sites, within those sites, we needed to identify the high streets. And we did this also, and this talks back to what Chris was saying about interdisciplinarity. We wanted to do this with sort of knowledge provided by our colleagues that are working closely with the community. So we went to them and said, so where are the places that are important for the communities in these sites? And they said, these are the places, and we mapped them, and then we created these sort of activity areas in these sites. And then we identify the high street that were relevant for those sites. And then we went back to them and said, does this make sense? Is this high street the high street that is important? And after this sort of bottom up, informed by the community, and top down, informed by the spatial data, because this our high street were informed by the Ordnance Survey high street retail geographies. Then we combine these two things to identify these are going to be our case studies. That said, I haven't mentioned which are the 8 high streets. So not the 8 sites or the 8 high streets. So the 8 sites are, let's go back to this one for the sites. So are Keighley, Bolton Woods, Barker and Bradford Moor and Parkside in Bradford, and Croxted, Toxted, Dog Branch, Birkenhead, and Speke in Liverpool. And within those, we identify the high street. We're also working with Speke in Liverpool, our colleagues are, but for the practicalities of the historical comparison, we wanted to have the same number of high streets with similar characteristics in both sides. So we left the high street in Speke out of this analysis. So we ended up with these 8 high streets, 3 established high streets in each city, and 1 more modern high street, or even less established, more like a community local center. So the high streets in Bradford are North Street in Keighley, Barker Road in Barkham, and Manchester Road in Parkside, and Livingston Road in Bolton Woods. But this is one of those that it's not really established high streets. And in Liverpool, we studied Lodge Lane in Toxteth, Grange Road in Birkenhead, and Grange Road West in Birkenhead too. And Mossway, these are the three established high street, and Mossway is the newer, sort of the around 1950s established high street in Croxton. Okay, so for these 8 high streets, what we decided to do was to map these spatial patterns that I mentioned before across time and space. So we mapped street network to be able to estimate space index measures of centrality, which basically gives us an idea of the importance of the street in the whole street, of the high street within the whole street network. We also map build form patterns, and we did this by mapping the building footprint contemporary and then drawing back, making the changes back to what was going on in each one of the epochs, and that allows us to see the changes in the buildings. When was something built, or when was something demolished, or how it was consolidated, like what we see here in green. And we also map land use patterns. And this was also very intensive in terms of labor, because we had to go to the trade directories and extract the text that identify the non-domestic activities happening in that high street, and then clean that data and then classify it in terms of land uses, and then map it back to our historical maps. So what we found. So first, for the street network, which is telling us something about potential movement flows. So here we're seeing 2 sort of indicators of measurements of street network centrality. So choice, which is measuring how much a street functions as a thoroughfare, how often it lies on the route between one place and another. So in a way, the potential of through movement that street has, like a link function for that street, that's choice. And integration, which is measuring how accessible a street is as a destination. So the potential of that street to attract movement to that street as a destination, as a place. So choice, let's think about it as link function, and integration as place function in the more sort of transferred language. So what we found in Bradford is that 3 of our 4 cases, Barker Road, Manchester Road, and North Street in Keighley, were highly central, both at the local scale and at the city scale, which is also what these maps are showing. And apologies, I do understand that I reckon that these maps are quite dense and difficult to interpret. But what we're looking here is basically this red color is telling us that it's highly central. And as I said, these 3 high streets are highly central, functioning as a link and a place, both at the city and the local level. And Livingston Road, this one that is more like a community identified high street, is not central at any scale or for any of the 2 measures. In Liverpool, we see a more diverse pattern, and we see Grange Road West, which is down here, being highly central as a link and as a place at all scales, so the city and at the local scale. Grange Road is strong, which is just next to it, is strong as a place at the city and at the local scale, and less so as a link, especially at the city scale. And this might be related with the fact that it's a pedestrianized street, so city scale movements has to do with motorized traffic most of the time. Then Lodge Lane, it functions very much as a link at the city and local scale, but also as a place at the city scale. So a place where people from everywhere in the city goes to. and this is what this map is telling us. And Musway, it still works also as a link at the city and the local scale, but it has a relevance as a place, mostly at the local scale. So I know this was a lot of information, lots of maps. So let's try to see what this means in terms of our salutogenic, healthy high street context. So the key message here is that well-connected high streets are enduring health promoting assets, but connectivity is not enough on its own. And what this is saying is that yes, the theory says that if we have highly connected high streets that are highly central, they should enable walking and access. But really, this depends on what's happening on the ground. And this is an example from Manchester Road, where on one side we do have the uses, the accesses to services, but on the other side, this is lost, and we will see more of that when we go to the build form. And basically, what we're seeing here is that when we talk about these two functions that I mentioned before, that the link and place function, what we're saying in essence is that in this high street, we have two competing things happening at the same time. And if we need to address those competing things, we need to make decisions. And in essence, making those decisions means prioritizing something, maybe prioritizing certain users' needs. And what happened in Manchester Road, it was happening all around the world around the 1960s, 1970s. Everything was favoring traffic movement. So yes, it's very central, it's very well connected, but it was designed at the street level to facilitate the movement in a vehicle movement, and much less so pedestrian movement. And basically, it's impossible to say that connectivity here in any way facilitated or enabled walking or access to services. And when we see the lady in the previous image and the gentleman here just jumping the guardrail to try to get to the other side, this is not healthy at all. And if anything, it's introducing a concept called severance, which is we have the wide road, the high traffic, the high traffic volume, traffic speed, and we just basically create a river effect in the community, separating the two sides of the community. So this is not good for social capital either, for mental or well-being, mental health well-being either, and the evidence tells us that as well. So now let's talk about building area and frontage length, which we are associated with social encounters and sense of identity. So again, lots of information here. Let me try to walk you through it little by little. So we're saying the same information presented in two ways. We have the maps, which are sort of illustrating the areas, the building footprint areas, and the frontage length. And we have the plots here, where we can see the evolution from one epoch to the other. And basically what we're seeing is that since the 1960s, many of these high streets experience an increase in footprint areas and longer frontages. And this is what these larger boxes are telling us, and this is what these larger areas are telling us. And this happened basically because there were falling building counts and plot amalgamation. And again, this is what we see here, that we go from this to this to this plot amalgamation. This high street that we have here is Grange Road, and this shows here in our plots as the sort of the one with the biggest change. But interestingly enough, just next to it, Grange Road West, which is here, is telling a slightly different story, which less increase in the building area, increase in the frontage area and the variation, but not so much in the mean. And when we look at the actual map, we can see that there isn't that much change. And what this is telling us is that these fine-grained patterns are more likely to survive in streets that kept their pre-1900s building stock. And this is what we're seeing here. So again, lots of information. What does it mean? So what does it mean in terms of our healthy, salutogenic high street context? So the key message is that fine-grained building patterns support well-being, but in some streets, some high streets are disappearing. So we know that having this variety of building shapes and sizes is good for land use diversity, because these smaller shops can accommodate more easily independent shops or ethnic minority businesses, and they, because of that, and in our framework, this make this environment healthier. So when this fine-grained build form disappears, these changes reduce the build form capacity to support this mix of small shops, of diversity of services, of diversity of cultures or ethnicities, uh, sort of visiting and serving the high street. And this is not good for the high street, and this is not good for uh, the role that the high street has in helping us connect to others. And then if we look at this in more detail on the ground, when we have these longer active frontages, if we see the build format, this sort of interface between the street, the public street, and the private place. So when we have these long frontages, there are windows or walls, and they are not permeable, we're losing this connection between what's happening on the street and what's happening inside, which in general is not good for safety. Like, it's good for safety to see and be seen, but also it's not good for the co-presence and the sort of social connectedness facilitation that high street should invite. Um, this is even more clear when the is not just a window shop, but it's a blank facade. Then it's definitely not happen. So this, what we have here is Grange Road, and this is Grange Road West, and this goes back to what I was saying of the smaller plots allowing this diversity of uses of ethnic minority businesses and other things. Um, and this brings us nicely to land use patterns, which we say that is related to movement, access to services, and co-presence as well. So final two complicated charts, I promise. That for this one, let's focus on the colors, because this is showing us the composition of each high street in terms of the percentage of the land use at each epoch. So if we look at red, knowing that these are two industrial cities, what we're expecting to see and what we do see is that industrial land use disappeared from most high street by the 1960s, but definitely by the 2020s, industrial use has disappeared. And it seems that it was replaced by other land uses like retail, maybe hospitality, like restaurant, pubs, and hotels. But if we focus more on the sort of health promoting uses, or the maybe community services and service sector are more relevant for community. And if we look at community services, we can see maybe an increase of community services land use in some high street for the 1960s, but then overall decrease by the 2020s. And for service sector, a similar pattern can be seen, except for background growth. So when we look at diversity, basically we see a slight increase for all our high streets except two. And I'm looking at this side of the graph of the chart, which is non-industrial uses only. And what we see here in green is Manchester Road, which again, because of the reason we've discussed, lost diversity, and Grange Road, which again, lost diversity. So the key message here, and now all of this is becoming kind of repetitive because this is hinting to what we are going to talk about in terms of implications of policy and practice, but basically a dense and diverse mix of uses sustains the everyday life of the high street. This is what gives people the reasons to be out there. So implications for policy and practice, and actually these are presented almost like recommendations. So let's read them like that. So the reason why, as I was presenting, things started to sound maybe a bit repetitive is because we started saying that we were conceptualizing healthy high streets, healthy and salutogenic high street as a multidimensional temporal concept. And the reason why this is important is because high street needs to be understanding this way if we want to think about health. there isn't one thing happening in isolation, really. It's not only about high connectivity, because we saw that that was given in Manchester Road, and that doesn't ensure that this is a healthy high street. It's not only about build form, although we know now, we've identified that build form is the sort of enabler of land use diversity. So maybe you get build form right, and then land use diversity, it's also going to be easier that this land use diversity is right as well. And the connectivity is important. This is going to allow your the high street to sort of persist and to be sustainable, but at what cost? And this is why Manchester Road is such an interesting example, because we can see how the first vocation was very much about place as a place for shopping, and then the public transport. And then little by little, giving more priority to cars, the road was widened, and then we get to the point in which we get this massive road widening, and then we see the cost that that has in our built form here. And then, because this is what facilitates the land uses, then we see what happens with the land uses too. That said, we're seeing an evolution, and this is why this is about evolution. It's not just changing; it's going from evolving from something to something else. And we can see Manchester Road now going back here to the original vocation of public transport, which is more people oriented than just providing for private vehicles, and definitely healthier with the crossings here, and not just this adventurer pedestrian here just risking his life just to get through the other side. And more in that direction is that when we do that, those changes, and we see those changes that actually hurt the health promoting capacities of high streets, well, they can be undone or repaired to some extent. And this red bridge over Manchester Road is a great example. So Manchester Road is really important. It's highly central. We need to refocus it on the movement of the user, that it's really important for society. And this is where the bridge comes in. And for this, the nature of the design is not a trivial, of the design of the bridge is not a trivial matter. If we see the way it meets the ground, it makes it much more connected and more convenient for the pedestrian for the person to go up and down, and also for the bicycles. And the width, it allows the conviviality, so it feels more like a street, an elevated street, than an actual just a bridge. And the curves allow visibility, which again are important for safety. So another important thing, so high streets, healthy salutogenic high streets are multidimensional, temporal. To add to the complexity, so the places in high street are multifunctional. And this means that the relationship of these places with health is also complex. So we have places that provide different services, maybe food, maybe beverage, and maybe cleaning, in this case with the laundrette, which are also community hubs or places of local identity because of the architecture, maybe, or just because they've been natural gathering places for generations. So their presence in terms of well-being is considered a salutogenic feature. That said, the aspect of the unhealthy, maybe retail offer or the other thing, needs to be considered as well. Another sort of recommendation for policy and practice is that historic high streets need to be seen as strategic health supporting assets, and they need to prioritize for investment with a people-centered design. And this goes back to all the discussion that I just did about the example with Manchester Road. They have, high street have the capability to be health promoting and to be salutogenic, to promote well-being, but it is not always the case. They need to be people centered. They need to have healthy streets, wide, and it goes back to one of my earlier slides when we have when we were seeing that if we have people just walking next to a cliff, then it's not going to be healthy for them. So we need benches, we need trees, we need the features that make this high street a healthy environment for people. But they are indeed a strategic health supporting asset. protect fine-grained built form, as smaller plots and active frontages are more adaptable. And they are the sort of engine behind the capability of high street of sustaining diversity and accessibility and therefore social interaction. So when we're talking about this careful balance between change and persistence, this is one of the things that is important to protect. Maybe with the building and such, if not possible for whatever reason, with the scale. And then for the high streets that are not historical, long-established high streets, I didn't talk a lot about them, but I want to mention them here in the implications because, as I said, when we were choosing our case studies, Musway in Croxted appeared as one of those because it was important for the community. So because this high street might not be that important as a place at the local and city level or as a link, they might have lower footfall, and this might mean that sustaining businesses in this high street is going to be more difficult. However, they often provide vital community and help promoting social infrastructure, so they need to be supported. And I think from the source of this picture, they said that these people were gathering here because the local library was being open. So they are as important in terms of health promotion as the long-established more central high street, and they need support. And finally, if we're thinking about regeneration, which is happening a lot in our studied cities, we need to remind ourselves again and again that it's not about regeneration of high streets, it's not about retail or transport renewal. Again, it's about health support to social infrastructure investment, which is done via investment in diverse everyday uses, adaptable premises, which we know it has to do with the fine-grained built form, and walkable people-centered connectivity. So now, really, to end, I want to bring two quotes that I think capture nicely sort of the spirit of what we think a healthy, health promoting and salutogenic high street is. And high streets aren't only about shopping, they're about identity, culture, and belonging. We need to claw them back as places of participation, empathy, and togetherness. And if we do that, we're in the right track to getting our healthy high streets. And we know that high streets are well connected. They're going to survive, to adapt over time with their build form and then their centrality. But if we want to have healthy high streets, we need to plan them for life and not for life. And just a final mention that all our plots and and the graphs and all the wonderful maps that I presented there are part of this paper that we're going to be publishing soon. Hopefully, we're doing revisions at the moment. So a big thank you to the whole team and Dr. San for all her hard work in this too. And thank you. And now it's time for questions, I think.
Brilliant. Thanks, Adriana. That's great. And thank you again for today. It's been a really great and interesting presentation, and for other colleagues as well for their inputs from UCL. So we'll wrap up there, just a few minutes over, but it's been well worth it. So if you're off over the summer, enjoy your breaks, and we will be back in the seminar series in the early autumn. So thanks everyone for your time, and look forward to seeing you again soon. All right, bye.
Thank you.